Welcome to this Conference of States Parties side event. My name is Connie Lauren Bowie. I'm going to be your moderator today. The event is being hosted by Inclusion Canada. And I'm sorry, I just lost the slides. Can someone just put the main slide back up again?
Yeah, absolutely. We can do that.
Thank you. I need the slides back up. Okay, thank you. Thanks again. Sorry. We are going to give you a few housekeeping notes to start today. We're really pleased to be here. This is a side session that's really important to Inclusion Canada and Inclusion International. We're also really happy to have ARCH, the Disability Law Center, joining us. Since we're here in New York at the Conference of States Parties, we think this is an important opportunity to spotlight a really important issue that is happening in Canada that we think is relevant to friends and colleagues globally in the disability rights community. So thank you everyone for joining us today. To start, we'd like to run through some accessibility items with you. A summary of this information has been pasted at the top of the chat box. You can access the chat box by clicking chat in the navigation bar at the bottom of the Zoom window. This event will be presented in English with American Sign Language interpretation and English CART captioning. To turn on English CART captioning, please click the link provided in the chat box. The CART captions will appear in a new window. Using the toolbar along the top of the window, you can adjust the caption size, font style, and color. You can also change the background color. ASL interpreters have labeled their videos to make it easier for you to locate them. We will be spotlighting the interpreters so their video always remains visible on the screen. Today's event, entitled Canary in a Coal Mine, the expansion of medical assistance dying in Canada, will relay very serious concerns on how Canada is euthanizing people with disabilities. The first few panelists will be people with disabilities, organizations of people with disabilities, and legal professionals from Canada. And then human rights experts from Peru and Spain and the Special Rapporteur on the Rights of Persons with Disabilities will respond. I'd like to turn the floor over to Robin Acton, President of Inclusion Canada, who will provide the land acknowledgement and introduction. Thank you, Robin.
Thank you. As Connie said, my name is Robin Acton. I'm a middle-aged white woman with shortly styled gray hair. I'm wearing a black high-neck jacket. While we meet today on a virtual platform, I would like to take a moment to acknowledge the importance of the land with which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improve our own understanding of local Indigenous peoples and their cultures. I am joining you today from New York City, the traditional land of the Lenape peoples. The issues we're discussing today impact the Inuit, First Nations, and Métis peoples living in what is colonially known as Canada. On behalf of Inclusion Canada, thank you for joining us today and for listening with an open mind to the concerns we're raising. While Canada legalized medical assistance in dying for people who are terminally ill in 2016, the law was amended in 2021 to allow for people with disabilities who are not terminally ill to be euthanized. As a mother and a spouse of persons with significant disabilities, I am not only alarmed, but genuinely fearful of the impact of this legislation on the lives of people I love. We want to warn other countries of our experience. I implore you to listen carefully to our presenters and heed our warning about the dangers of medical assistance in dying legislation, such that what has happened in our country does not become the blueprint for what may happen in yours.
Thank you so much, Robin. I'd like to now introduce Catherine Frizee and Steve Esty, who will provide opening remarks. Steve's not, excuse me. Catherine, if you can hear me, we can unmute Catherine's mic. Thank you.
Right now in Canada, disability rights defenders are actively battling a 5-alarm fire. We cannot extinguish it. Our top court and our elected leaders have seen to that. But we are working round the clock to contain it. We are on the ground every day in ways I had never imagined in my 68 years of disabled life, fighting to save the lives of our kinfolk, drawing folks in to a community that cares whether they live or die. We are fighting a state policy of assisted suicide that speaks the quiet part of ableism out loud and clear, the premise that death may be preferable to disabled life. We've all fought fires before, but this fire is different. This fire wraps itself in the language of rights, autonomy, and choice. This fire stalks those of us who are at our weakest moments. This fire systematically chokes out the life force that sustains us, that desire to live and fight another day. This fire threatens to rob us of tomorrow's leaders and elders by normalizing death as the expected response to the struggles of our disabled lives. Struggles that arise from abandonment, stigma, deprivation, despair, and loss. Among those in the business of fighting actual forest fires, the parts of the forest that are not yet engulfed in flames are often referred to as unburnt fuel. I was chilled to the bone when I first heard that stark framing, yet it haunts me more than ever now, as I witness the lives of my disabled kinfolk reduced to the status of unburnt fuel, the unburnt fuel of the insatiable fires of an ideology in which rights are commodities wielded by individuals in the marketplace of social power. That's not what rights are. Our urgent call today to the global human rights community is not ideological, nor is it religious. It is rooted in an understanding of disabled people's history, which, let's be honest, is a history of eugenic atrocity. And it is also rooted in the realpolitik of our times, a candid assessment of where disabled lives rank in global and domestic social policy. When waves of austerity, climate disaster, or pandemic contagion sweep the land, disabled people disproportionately suffer. Disabled people disproportionately die. These are not anecdotes or hyperbolic assertions. They are facts. They are facts here on Turtle Island in the land known as Canada, and they are facts wherever you live as well. That is why we need your help, and it is also why you may need our help. This fire threatens all of us. In the most insidious way, the very foundations of equality for disabled persons are being hollowed out. Our guest today will speak vividly about what this looks like on the ground. I urge you to listen carefully and join with us to fight these fires.
Thank you so much, Catherine. You've set the tone for, I think, a really important hour. We are really pleased to be here in New York to be able to raise these issues and raise awareness about the situation in Canada, and to ask our colleagues in the cross-disability human rights movement to join us and fight off this model. Unfortunately, Steve Esty was not able to be with us today. We will continue on with the rest of the panel and speakers. Over the next hour, the panelists will provide brief presentations about how Canada's model of euthanasia is threatening people with disabilities in Canada and around the world. The panel will be followed by a brief Q&A that is open to all of our attendees. If you'd like to ask a question, please submit the questions using the QA box on the right-hand Zoom side of your Zoom window. Actually, on mine, it's showing up in the middle. So it's the QA box at the bottom panel of your Zoom. We will monitor those questions and we'll do our best to direct them to panelists at the end of the session. So I'd like to introduce our first panelist, Krista Carr from Inclusion Canada. Krista, thank you.
Thanks, Connie. Thank you, everyone, for joining us here today. My name is Krista Carr, and I'm the Executive Vice President of Inclusion Canada. I am a middle-aged woman with short blonde hair and fairly large tortoiseshell glasses and a orange top and scarf on. Euthanasia is called medical assistance in dying, or MAID in Canada. Assistance in dying. It sounds quite palatable, doesn't it? Almost inviting. It is language that was advanced by a well-resourced lobby group and adopted by the state. The language of medical assistance in dying implies just that. Choice in how you die, not if you die. There is a difference, and I want to tell you about it. When euthanasia was first legalized in Canada in 2016, the only people who were terminally ill had access to this special assistance to die. The end-of-life requirement was something people with disabilities and DPOs had strongly advocated for. We believed that limiting the scope of euthanasia in this way to people who were terminally ill would be an equalizer. We hoped it would make disability relevant, but not determinative of MAID eligibility. The safeguard wasn't infallible, though. The first year, people with disabilities like Archie Rowland died because they didn't have access to dignified support. Rowland is quoted as saying, "It's not the illness that's killing me. I'm tired of fighting for compassionate care." His death was one of the early signs that something was terribly wrong. Jean Truchon was another canary in the coal mine, a true warning that Canada was and is failing people with disabilities. Truchon challenged the end-of-life requirement in court. He wanted to die. His testimony spoke in great detail of the monotony and the inhumanity of institutionalization. Jean Truchon had fought for years to get out of that institution, and with no success. And finally, he decided death was his only option. The one judge who heard the case struck down the end-of-life requirement, permitting Truchon to die by MAID. He ultimately expedited his death when COVID restrictions in the institution he lived in prevented him from even spending time with family and friends. Canada didn't read the warning signs. Government decided not to defend the end-of-life criterion that was so important in the legislation for persons with disabilities. Elected officials didn't scrutinize the social conditions that cause suffering or recognize the signs of a systemic crisis, instead attributing suffering to the very bodies of disabled people Government chose not to appeal the decision and that one judge, and instead opted to make people with disabilities, and only people with disabilities, eligible for MAID when they are not already dying. They did so at such a rapid pace that we could barely keep up. Indigenous communities actively enduring a youth suicide crisis were largely excluded and never meaningfully engaged. Many concerned Black and racialized people with disabilities were denied the opportunity to speak. And all of this during the COVID-19 pandemic. The legislation was first tabled in 2020 and passed in 2021, and it has been an utter disaster. Inaccessible, unaffordable housing, poverty, poor pain management, food insecurity, lack of mental health services. People are calling and emailing our offices, warning us every day that it's easier to die by MAID than to get the support that they so desperately need, and that dying isn't off the table. People like Rosina Camus, who said, in Canadian society, we have a culture of killing instead of caring. And Sophia, who said, I applied for MAID because of abject poverty and to escape her apartment, which she called a dungeon. They have died because they felt they had no other option. Our government dismissed and dismisses our concerns, and people with disabilities are dying. The least we can do is warn you. Don't let your countries model their laws after Canada. It's a glaring violation of the CRPD. And believe it or not, things are about to get worse for us. Canada will legalize MAID for people who are mentally ill in 2023. And a government-appointed panel just recommended that euthanasia be made available to those in situations of involuntariness, such as when they're forcibly confined to psychiatric institutions. This same panel has made recommendations for how to best track when MAID is provided through a supported decision maker, a practice we, Canada's Organization for People with Intellectual Disabilities and their families, weren't aware was occurring. And a government committee is currently contemplating euthanasia for minors and by advance request. These consultation processes are hostile. People with disabilities and their allies are invited to speak one moment and ask questions aimed not at understanding, but at undermining them the next. Some are brazen enough to tell us that there is absolutely no evidence of abuse. It's not surprising. We now live in a country where life with a disability is literally framed as a life worse than death. The stigma, the ableism, it's pervasive. People with disabilities are alarmed and they're afraid. Take note that these pro-euthanasia groups are at work around the world. They make euthanasia on the basis of disability sound like agency, and death from discrimination sound like compassion. Don't be fooled. Let Canada be the canary in the coal mine. Thank you.
Thank you so much, Krista. Next, we'll hear from Carrie Joff from ARCH Disability Law Center, who's representing a large coalition of disability organizations seeking to challenge the legislation internationally, and coalition members Sarah, Rohini, and Gabrielle.
Thank you very much, Connie. I'm just waiting a moment for some technical. Thank you very much, Connie. Hello, everyone. I am a white woman with long brown hair. I am wearing a dark gray jacket and a white shirt today. It is great to be with you all today, and thank you so much to everyone who is joining us for this event. In Canada, medical assistance in dying law, known as MAID, allows doctors, nurses, and others to give a person medication that will cause their premature death. Only people who meet certain eligibility criteria in the law can die by medical assistance. When this was first legalized throughout Canada, it was only for people who were suffering because of a disability, illness, or disease, and their natural death was reasonably foreseeable, meaning it was a way for people who were near the end of their lives to die sooner. Last year in March 2021, changes to the law expanded eligibility. Canada now allows people with disabilities and disabling medical conditions to get medical assistance to die when they are suffering and not at the end of their life. This is known as 2 tracks of MAID. Track 1 for disabled people whose natural death is reasonably foreseeable, and track 2 for disabled people whose death is not imminent. As my fellow panelists have already spoken about and will continue to speak about today, disability communities from all over Canada are distraught about the impact that this law is having on diverse disabled people. And we are particularly concerned about track 2. ARCH, the legal clinic where I work, represents a cross-disability coalition of 20 disabled persons organizations, grassroots advocates, and disability organizations from all over Canada. And this coalition is challenging Canada's MAID law as a violation of the CRPD and other international human rights treaties. We argue that the expanded law, Track 2, which allows for assisted death for people who are not dying imminently, violates Article 5 of the CRPD, the right to equality and freedom from discrimination. The law discriminates by making an explicit distinction based on the protected ground of disability. Only people with incurable disabilities, diseases, or illnesses can get medical assistance in dying if they are suffering because of their disability and they meet the other eligibility requirements in the law. People who are suffering but are not disabled cannot get medical assistance in dying. Instead, they may be offered social services and suicide prevention programs or other supports. And in this way, the expanded law singles out disability-related suffering as a criteria for assisted death. This distinction reinforces in law the ableist assumption that the lives of people with disabilities who desire an end to suffering are less valuable than others. In February 2021, Professor Quinn, who you'll hear from later, and 2 other UN experts issued a letter of concern to Canada that this Track 2 of the law risks violating the right to equality in the CRPD. Second, and equally important, Canada's law violates the right to life protected under Article 10 of the CRPD and other international human rights treaties. The UN Human Rights Committee has said that assisted dying must have strong safeguards to be sure that it is being done with free, informed, and unambiguous consent, and to protect against pressure and abuse. Put simply, people must have free choice when deciding whether to apply for medical assistance in dying. However, in Canada, many people with disabilities do not have free choice. Their choices are severely constrained by ableism and inequalities. Even though Canada is a wealthy country, many disabled people live below the poverty line. Compared to non-disabled people, people with disabilities are much less likely to have work and much more likely to be homeless. Canada's income support programs do not give enough money to raise disabled people out of poverty. And there are many barriers that prevent disabled people from accessing housing and disability supports and specialized medical care. The media, disabled people's organizations, and civil society groups in Canada have documented cases of people with disabilities dying by medical assistance out of desperation because they are living in poverty, extreme isolation and loneliness, or being forced to live in an institution, or could not get the services and supports that they need. These experiences show in real life that Canada's law does not have the necessary robust safeguards to ensure free choice. I want to be clear today that we absolutely do not want to undermine autonomy rights or the right to legal capacity. Everyone must be free to choose, especially when it comes to deeply personal decisions about life and death. But we do point out that Canada's law appears to offer freedom to choose medical assistance in dying. But in fact, there is no freedom of choice for many disabled people. Instead, they are pressured into medical assistance in dying by social and economic inequality, a lack of real alternatives to live with dignity in the community, or a lack of medical services. And as Catherine said, these are not theoretical concerns. Tragically, it is real, and it is happening to disabled people in Canada. As I reflect on the overarching theme for this COSP, which is building disability inclusive and participatory societies, what comes to mind is that Canada's medical assistance in dying regime has exposed many of the inequalities that disabled people live with, both on the ground and in the assumptions that underlie our laws and policies. And it makes clear how far we really still need to go to build a truly disability inclusive society. I want to thank my fellow panelists and coalition members, who you will hear from very shortly, for sharing their thoughts and experiences on this difficult issue. Thank you, everyone, and back to you, Connie.
So I'm just going to introduce the next speaker, who is Sarah. Thank you, Carrie. Oh, that probably didn't work, right? Because my volume wasn't on.
Sorry, am I allowed to start?
Yes, Sarah, you go ahead.
Okay, sorry. Hi, everyone. My name is Sarah Duma, and I'm the Executive Director of a youth-led organization in Hamilton, Ontario called the Disability Justice Network of Ontario. Hamilton is significant because we have the highest density of disabled people per capita in the province of Ontario. The Disability Justice Network of Ontario aims to build a just and accessible Ontario where people with disabilities have personal and political agency, can thrive and foster community, can build the power, capacity, and the skills to hold people, communities, and institutions responsible for the spaces that they create. So I'm 28, I'm Somali, I have cerebral palsy, I use a wheelchair, used to use a walker when I was younger. I grew up on ODSP and spent most of my life on social assistance with my family. And, you know, I believed at one point that the meritocracy was real, that even though we were in and out of the shelter system, we used food banks, like that if I worked really, really, really hard, I could, you know, surpass everybody's expectations and build a life for myself. I believed in the Canadian dream. But as I got older, and as I'm now 28, I've realized that this dream of disabled people being equal, especially if you're Black or racialized, is a complete fallacy. And I can give a couple of examples to explain why I believe this. The government has made it easier for disabled people to kill themselves than it is to survive. And I've seen this throughout my entire life. And as someone who's currently not on social assistance, it is still a struggle. When the pandemic first hit, all the food banks in Hamilton had closed and weren't delivering. And my friends and I worked to create a food delivery service and spent like 60 hours a week trying to make sure that we could feed as many people as possible. We also, during this time, were supporting many houseless people who were disabled, many who were racialized or Indigenous, who were living in parks because they had acute mental health needs and were being actually evicted from shelters, kicked out because their disabilities were seen as disrupted, seen as a problem. And then police would come and kick them out of the public parks where they would set up their tents. So when there's no accessible, affordable places to live, when social assistance rates are legislated below the poverty line in every single province, when you're being criminalized and arrested or harmed because your mental health needs are too much for the shelter systems and you can't afford a place to live and no one will hire you. When we came to find out that about 30 people at the Barton jail in Hamilton have their medications withheld from them, people who are racialized, who have schizophrenia and other diagnoses aren't getting proper treatment. When disabled people are continuously told again and again that we have to wait on wait lists for pain clinics, when you get cut off of almost every service when you turn 18 in Canada, even though we're told that Canada has universal healthcare, people pay thousands of dollars for their assistive devices, for dental care, to be able to actually see doctors and buy your proper medication, because not all of your meds are covered. It builds a case to say that it is harder to live in Canada as a disabled person. Yesterday, the Toronto police released a report saying that if you're Black in Canada or in Ontario, essentially you have a higher rate of being policed and harmed or strip searched. They said in Toronto that Black people who were, or Black people specifically, who were interacting with the police were 200% more likely to be harmed and criminalized or have a weapon pulled on them. And that rate is increased when you talk about disabled people. So I'm thinking about Ijas Chowdhury last year, who was on a mental health call and he was killed by the police. I'm thinking about DeAndre Campbell. He was a bit younger than me in Brampton, a Black man who called the police on himself routinely for support, because they usually transported him to a hospital, and he was killed. He was killed by a rookie cop who was scared because of what he looked like. I'm worried that having delegated at Senate and talked to parliamentarians, having done all this work to try to convince them that MAID and the expansion will disproportionately impact Black people, racialized people who already face medical racism and are already struggling to have a will to live, is not being heard. And I think that will continue to impact my friends and my community. And so this expansion is eugenics and will continue to cause more harm than good. Thank you.
Thank you so much, Sarah. Can we next, Rohini, if you could unmute yourself, our next speaker, Rohini, please.
Thank you very much, Connie. Can you hear me well?
Yes, we hear you. Thank you.
Thank you, Connie, and hello to everybody. I am a middle-aged woman wearing glasses. I have long brown hair with streaks of gray. I'm wearing an orange cotton blouse. I am of East Indian origin. My name is Rohini Perez, President and CEO of the Environmental Health Association of Quebec, a community organization. Our focus is to raise awareness about multiple chemical sensitivities, known as MCS, and to support people living with this disability. Over 1 million Canadians aged 12 and older have been diagnosed with MCS, caused due to sensitization to chemical pollutants. MCS is recognized by the Canadian Human Rights Commission as a disability with the legal right to accommodation. MCS is triggered by exposures to fragrances and to commonly used products such as personal care products, cleaning, laundry products, deodorizers, as well as chemicals emitted from building materials and furnishings. Exposures to these chemicals results in symptoms which include brain fog, breathing difficulties, pain, fatigue, cardiac, urinary, musculoskeletal, and gastrointestinal effects. People with MCS also have higher incidence of comorbid chronic medical conditions compared to the general population. Over the past 20 years, Canada's population has increased by 24%, but the MCS population has increased by more than 100%. 72% are women and 49% are over the age of 55. This disability encompasses the full spectrum of all disabilities and touches all ages, genders, communities, and vulnerable populations. There is no known cure. Therefore, MCS must properly be managed, which primarily consists of avoiding exposures, especially at home and at work, by using least toxic products and promoting healthy spaces. Like many disabled people in Canada, people with MCS report systemic social and economic inequality. Their disability is often not accommodated, and so they lose their employment and have difficulty accessing healthcare and other essential services. They have high rates of food and housing insecurity. They often live below the poverty line and are isolated and stigmatized. They commonly experience lack of security of person and a lack of quality of life. Our organization has received many calls from many people with MCS who are neglected, abused, and stigmatized, living between a rock and a hard place, to inquire how to end their lives through medical assistance in dying or MAID, or to let us know that they will be applying for MAID. In many of these cases, people do not want to die. They just cannot find any real options to live safely and in health in the community. One tragic experience was Sophia's. Sophia, a lovely person, 51 years old, lived with MCS. She could not work. She could not afford her own home and lived in low-income multi-unit residential building where she had less personal control of the indoor air quality. Sophia had tried unsuccessfully to obtain healthy housing, which is considered the most significant medical need for her disability. Her home was often contaminated with cigarette and marijuana smoke and chemicals from the products used in neighboring apartments. So she lived in just one room in her apartment, which she called her dungeon. And she tried to seal off that room from chemical exposures. She was constantly ill. She had lost many teeth and was about to lose more because she could not access dental care without experiencing more chemical exposures. She had been verbally assaulted and lived in fear just because she asked her neighbors and landlord for accommodation for her disability. She wrote many letters and emails to all levels of government over a period of 2 years, begging for help to find housing that would accommodate her disability. Often, she did not get a response, or the response was dismissive. When all hope failed, she applied for medical assistance in dying. She felt there was no other alternative. She said, and I quote, "The government sees me as expendable trash, a complainer, useless, and a pain in the ass." Her doctors, including her maid doctors, wrote to the government and begged for healthy housing instead of death. In one of multiple letters they wrote, "We physicians find it unconscionable that no other solution is proposed to this situation other than MAID. We urge you to do something and communicate with us as quickly as possible." No one answered. Sophia was an advocate for MCS, but disabled by it, and was an otherwise healthy woman. She had her life taken by medical assistance in dying on February 22nd, 2022. Just a few weeks later, Canadian media reported that Denise, a 31-year-old woman with MCS, had applied for MAID and is waiting for a response from MAID providers. Denise, who also has multiple health conditions such as CCI and AAI, was clear that she had applied for medical assistance to die essentially because of abject poverty. She's living on government social assistance benefits and could not afford basic necessities. So she also could not get healthy housing. As Denise explained, when people are backed into a corner living in poverty for years on end, it doesn't feel like a choice anymore. Canada has health and social support systems which are meant to protect, help, and provide services to society. But many disabled people fall through the cracks. Canada's support systems clearly fail to protect and help Sophia. These are not the only people who have applied for medical assistance to die because they are living in terrible conditions and don't have any way out. This is affecting people with all kinds of disabilities. All of the above is worsened due to poverty, and the things needed to manage the disability of MCS are more expensive. People with MCS will tell you that unless they get meaningful help, there is nowhere to run and nowhere to hide. Instead of putting in place healthy housing and adequate income supports, Canada has created a law that allows disabled people to die because they are suffering due to inequality and barriers contributing to inaccessibility. Thank you.
Thank you so much, Rahini. I'm going to hand over to the next speaker, Gabrielle. Gabrielle, if you can hear us, thank you.
My name is Q Lawrence. I'm reading on behalf of Gabrielle Peters. I'm a young white person with short blonde hair, wearing a denim button-down. I'm situated on the land of the Chukwayak and Puyallup tribes of the Stalo Nation. In my acknowledgement of the land and its caretakers, I hold in mind that many Indigenous leaders and organizations have spoken against Canada's MAID regime, and their analysis and caution is of vital importance in this discussion. Now to Gabrielle's words. Thank you. It is an honor to speak here today. We have very little time and so much to discuss, so I will get right to the point. Canada is not as advertised. The myths and marketing that make up Canada's international image insulate the Canadian government from the scrutiny and criticism its expansion of assisted suicide warrants. Support for MAID relies heavily on Canada's reputation as a champion of human rights and assumption that the external enabling conditions necessary for supporting autonomy exist here. The fight around MAID is one for robust autonomy, but not as the proponents of MAID suggest. In reality, the same institutions and professions that regularly deny us autonomy over our lives disingenuously pretend to champion it over our deaths. We urge you to ask why. In their rhetoric, the proponents of Canada's assisted suicide argue that the state should not impede anyone's right to choose to die. There are three deliberate falsehoods in their assertion. The first is that MAID is a negative freedom, meaning that the state agree not to interfere in a person's ending of their own life. In truth, MAID is a positive freedom. The state is providing death as a service. This obfuscation of the state's role in causing the death, not merely failing to inhibit it, contributes to the lack of critical examination it receives. As a result, even the people who would oppose capital punishment in instances where the murderer confessed and requested it remain silent about MAID. MAID is fully covered under Canada's healthcare system. This is significant given what is not covered under Canada's healthcare, the barriers to accessing life-sustaining treatments, and how ableism, racism, poverty, and other intersecting oppressions impact medical diagnosis, treatment, and outcomes. And it is especially significant since, unlike other countries where euthanasia is legalized, Canada does not require that alternative options be made available, which leads us to the second falsehood, the claim that MAID exists within a framework of real choice. Canada's universal healthcare system is, in fact, not universal. It covers some parts of the body and not others, some aspects of healthcare and not others. The ableist bias also extends to how it is practiced and delivered, as well as in the use of the quality-adjusted life years formula. Significant variations in availability of care and coverage occur not only from province to province, but urban versus rural areas, and regionally from north versus south. A 2018 study published in the Journal of the American Medical Association ranked Canada 10th out of 11 well-off nations in terms of public spending on health as a percentage of GDP. 30% of health spending in Canada is private. In 1976, Canada had 6.9 hospital beds per 1,000 people. By 2019, that number had shrunk to 2.5. Now, our chronically starved healthcare system is in crisis. One of the people involved in crafting Canada's healthcare rationing protocols, Dr. Ike Henner-Klug, has argued that parents of disabled children should be given the right to request their child be euthanized. He is also responsible for establishing the Canadian Medical Association's Department of Ethics. Election campaigns are run on dehumanizing people with mental illness and promises to round up and re-institutionalize disabled people who are homeless. Disabled people, especially those who are Indigenous or Black, are killed by police conducting wellness checks. To this day, a significant number of disabled people under the age of 65 are forced into long-term care due to absence of affordable and accessible housing and the non-existence of community support. This is what led a disabled man named Sean Taggart to apply for and receive MAID. Canada is also a country of great wealth inequality. According to the Parliamentary Budget Officer 2020 report, the top 1% of Canadian households hold 25.6% of total wealth in the country, while the bottom 40% possess roughly 1.2%. 41% of people living at low income level are disabled. Disability benefits vary by province, but all are far below the poverty line, a poverty line that, according to recent research, has an ableist bias and ignores the increased costs associated with living as a disabled person in an ableist society. This means many disabled people regularly experience periods of hunger, go without medications or other essentials of life. In Canada, the state provision of death exists in a landscape of denial of rights, care, and deliberate deprivation, and therefore acts as a coercive power against disabled people instead of enabling our autonomy or providing us with choice. And this leads us to the third and final falsehood in their argument. MAID, for those not near end of life, is not available to just anyone. It is available solely to disabled people. Ableism is embedded in Canada's history and has been codified and institutionalized into every aspect of our society. The ideological beliefs and systems that supported and arose out of colonialism and white supremacy, including eugenics, never ended. They were just rebranded. The elimination of the end-of-life requirement and broad expansion of MAID depends on a belief that Canada's institutions can and will guarantee the necessary, consistent, universal, and unbiased level of transparent, accountable delivery and oversight. Within a society where the provision of real options to ensure that euthanasia isn't the only way to escape socially constructed suffering. A guarantee that not a single instance of abuse or error will end the life of a disabled person who would have wished to live if proper supports and real choice had been provided. Canada cannot make such a guarantee. Next week is the 1-year anniversary of the heat dome in my province of British Columbia. 619 people, mostly disabled, died in 1 week due to policies that did not allow them to escape the heat. Some who lived minutes from a hospital died waiting hours for an ambulance. 1 year later, we are still waiting for those policies to change. Canada is not as advertised. Thank you for your time.
Thank you so much. I want to thank all of the speakers who've given powerful and for many of the participants probably shocking testimony to the situation in not the theoretical situation, the actual situation. We were very anxious to host this event during COSP in order to draw attention to the reality of the situation in Canada. And several of our colleagues and human rights allies and activists have taken up the mantle and are joining us in trying to gain attention to this issue, both for Canadians, but also for other disability activists in other parts of the world. And so the next part of the session will be two of our colleagues who've been active and paying attention to this issue and helping us to raise up our voices. So Alberto, who is a human rights lawyer and disability activist from Peru, is joining us, and I will let you open your mic in one moment. And then following Alberto, we will have Gerard Quinn, the UN Special Rapporteur on the rights of persons with disabilities. So when you're done, Alberto, you can hand it over to Gerard directly. And welcome and thank you, Alberto, for being here.
Hi, Connie, and thank you for the invitation. Good afternoon, good morning, everyone. I'm a Latino man from Peru with black curly hair, wearing glasses and a white shirt. I do believe that the expansion of the criteria for medical assistance in dying in Canada and other jurisdictions should be a concern for countries in Latin America like Peru. This is a complex and contentious debate, and always personal beliefs and values tend to obscure important evidence about this day-to-day practice. And as we look at Belgium and the Netherlands, and now listening to Krista, Kerry, Sarah, Rohini, and Gabrielle, Canada too, countries where broad criteria for assisted dying exist, we have reasons to be concerned. The number of persons with disabilities opting for assisted dying without a terminal illness is steadily increasing, and only a small portion of people opt for euthanasia based on actual pain. And the main reasons are perceptions of loss of autonomy, loss of quality of life, loss of dignity. Many people express feeling as a burden, being lonely, or being unable to participate in meaningful activities, and as it has been said, this raises an ethical debate on what's driving people with and without disabilities to assisted dying, and what's the role of the state and society in addressing these social determinants. And currently, Colombia is the only country in Latin America that permits assisted dying based on a couple of decisions of the Constitutional Court. Last year, the court expanded euthanasia for people who are not terminally ill, and it seems recently, the sentence is not out, I think, yet, have also expanded on medical assisted suicide. Numbers are still very low in Colombia, with less than 200 cases in 7 years. Just to put a context, Belgium had 2,700 only during 2021, but it will certainly open the way to new initiatives within the region. In my own country, in Peru, we had recently an important case on euthanasia, which is pending confirmation in the Supreme Court. the first instance judge ruled in favor of the petitioner, Anne Estrada, authorizing her euthanasia. And the sentence, however, denied the petition to regulate euthanasia for future cases. But for me, the most impactful aspect of this case was the media coverage was completely ableist, which I believe negatively impact the public perceptions of persons with disabilities, and many of the campaign messages, including those promoted by the own Peruvian ombudsperson office, which provide a legal representation, revolve around the indignity of spending the day in the bed or in a wheelchair, needing around the clock personal assistance, or lacking privacy due to the need for intensive support. And organizations of persons with disabilities and disability activists were not involved at all or asked their opinions at any point. And so most of these messages remain unchallenged. And I think no one can question someone's personal experience of illness or disability, but I think as a society, we have a shared responsibility for the impact media can have on the disability community. And those who expressed concerns were told that we were falling into a slippery slope fallacy. And as it has been said already, that only those who wanted to access euthanasia would use it. And I really wish things were that simple. And in Latin America, where the debate on assisted dying is just starting, there are no community support services at all for persons with disabilities. Only 2 countries, and with a very limited scope, Argentina and Costa Rica, have some form of personal assistance scheme with very low number of beneficiaries. And I don't think I need to expand on the situation of mental health and psychosocial support services and institutionalization. People with disabilities in general are invisible and often treated as a burden, and life with dignity is unfulfilled. So I think it would be naive to think that these factors do not have an impact if the criteria for assisted dying include people who are not terminally ill or directly target persons with disabilities. And I think if there is something, and Gerard will agree with me, that if there is something that we have learned in the disability community over the last decades, it's the complexity of decision-making and the role of relational autonomy, and how much space is there to exercise freedom when society is constantly oppressed you and reminds you that your life is worth less than others. And plus, as we have witnessed it around the developed world, direct pressure from services and even threats are not uncommon. So I do believe that there is a right to die with dignity, and mechanisms should be established to guarantee that right. But I'm concerned that in trying to enable this principle, we're not thinking through the negative and potentially irreversible effects that they may have on certain historically discriminated groups. And I think ending human suffering is a goal we can all agree on, but we can just look at one end of the problem. I think the principle of dignity in human rights demands much more. And with this, I would like to pass the floor to Gerard.
Hello all. Connie, may I proceed?
Yes, please. Thanks, Gerard.
So thank you, everybody, and good morning, good evening, good afternoon, depending on where you are in the world. I am Gerard Quinn, the UN Special Rapporteur on the rights of persons with disabilities. I guess I'm a middle-aged white man with gray hair, wearing glasses and a red tie and a red shirt. I'm speaking to you from New York at the Conference of States Parties, but my home is on the west coast of Ireland. Just a few points I want to make, kind of zooming out from the debate. And by the way, I thank you very much for alerting the international community to this phenomena. As Alberto has intimated, this is already an active debate in Latin America, but it's also a debate in Spain, and I believe in Italy as well. So it's a very good service on your part to alert us to some pitfalls to be avoided, let's put it that way. I thought what I would do is just to zoom out for a moment and remind you what the core problematics were that we try to challenge in drafting the CRPD, and then to look at some of the solutions that we proposed and why this legislation or legislation of this kind is intrinsically problematical from the perspective of the CRPD. So the core problematic, and it's already been mentioned by Alberto, is invisibility, leading to the discounting of the humanity or the equal humanity of persons with disabilities. And you find that reflected out in laws and policies having a ripple effect right across the spectrum of policy, whether it's education, employment, transport, etc. So surprise, surprise, we thought going into drafting the treaty that it would be a straightforward equality treaty. But because of the consciousness of the depth of this invisibility, there was a consensus that what we needed to do was to put front and center notions of personhood, notions of human autonomy, but also thriving in community. And I emphasize the word thriving in community. And as it were, that became the anchorage point of the entire treaty. And then, because of course, what's the point of dealing with the symptoms of inequality if you're not dealing with the root cause? And we perceived that the root cause was this invisibility and discounting of the humanity of persons with disabilities. Then when it came to the equality idea, something interesting happened in drafting the treaty. Rather than just a very narrow legal tool to challenge what we call relativities of treatment, how you're treated relative to another person, it became a much broader, much deeper, much wider tool in the CRPD. It's about looking at accumulated disadvantages, which probably have accumulated because of the invisibility and the discounting of humanity in the past. It required a blending of civil and political rights, such as autonomy, with economic, social, and cultural rights, so that there's an active process of thinking about how do we reduce these accumulated disadvantages? How do we respond to people who present with these disadvantages? And then how do we intentionally build a much more inclusive future? And that requires economic and social innovation and spending and investment. So when we come back to the concept of autonomy and who could be against the concept of autonomy, I think it's really, really interesting to distinguish between the myth system of the idea and the operation system. And the myth system is fine. It posits an equal right to make decisions, whether small or large, in one's own life. But the operation system is completely different. The operation system imagines an architecture of choice with many different variables conditioning your choice. And the problem with people with disabilities is that that choice is weighed down considerably by accumulated disadvantages, which you can imagine are heightened with respect to different categories of persons with disabilities. So it's kind of a nonsense to talk about a free, open, uncoerced choice if you're not at one and the same time really radically and intentionally addressing economic and social supports, transformation of the service paradigm, expanding your healthcare system and maybe your housing system as well. In short, giving people a life and giving people the wherewithal to live the life they want to live in their community. To me, this is the biggest message of the sad debacle of your legislation in Canada. I note in passing that the legislature and the executive responded and maybe responded too quickly to a judicial decision or a series of judicial decisions. And it's always seemed to me it would probably have been wiser to create a cordon sanitaire between the judicial pronouncements and the legislative reaction, because it's reasonably obvious to me that they didn't think through the operation system of autonomy for groups like people with disabilities who've been burdened by the traditional lack of adequate supports in their lives. We intervened earlier on, actually as one of the first steps in my mandate as Special Rapporteur, and communicated with the Canadian government and built on the excellent work of the previous Special Rapporteur on ableism, as it were, telling the Canadian government that even though the intention might not have been ableist, that its impact certainly could be viewed as ableist. And if I were to rewrite that communication, I would not deviate from that analysis, but I would super add that economic social arrangements, economic and social rights are actually really the key to affording genuine autonomy instead of the myth system that is represented in the law at the moment. And I think the lessons are obvious for countries in similar situations around the world. Thank you so much for your time.
Thank you so much, Gerard. I'm going to attempt to table some questions for the panelists. Being here in COSP with disability activists from all over the world, I think what's been really alarming is that there's a denial of the reality of this story. There is a narrative that is, this is simply a liberal end of life, innocuous legislation. And even within the disability community, I think there's a lack of awareness of the fact that this is
Connie appears to be frozen. Connie's internet is offline. Okay. She's trying to get back on. Connie, no, I don't think you're there. I'm just checking. Carrie, can you jump in since you're with the?
Yes.
Okay, great.
I was just going to offer to do that, Krista. I saw in the Q&A, there was a question posed about whether somebody could comment on why the Canadian legal development is uniquely concerning, and how Canada doesn't even require physicians to agree that no other options are available to relieve suffering. So I can take a stab at addressing that question. There are a set of safeguards in Canada's law for both tracks of MAID, the track 1 for assisted dying for disabled people who are terminally ill, and track 2 assisted dying for disabled people who are suffering but not dying. And those set of safeguards are slightly different. For Track 2, the medical professionals who assess eligibility for MAID and provide MAID must inform the person what the available services are to relieve their suffering and offer them consultations with those services. And there must have been some discussion about the means to relieve their suffering, and the person has to have considered those. But as the person who posed the question noted, there really is no requirement for multiple healthcare professionals to agree that there are no other options available to relieve the person's suffering. And one of the issues, in addition to that, that we wanted to highlight today is that these safeguards really are about providing information to people about what the options are that may be available to relieve their suffering, but there's no explicit assurance or right within the Canadian legal context that those services or supports be available to the person or be available to address the person's real needs. And that is really part of what creates this social and economic pressure that is driving some people to, resort to MAID really as out of desperation and a last resort option. And in many cases, as our speakers have highlighted today, those supports and services are in fact, maybe in theory available, but are in fact oftentimes not available on the ground. And I wanted to just highlight in relation to that, there's the issue of, the lack of available social and economic supports. But the other issue that I think we wanted to really highlight today was just around the fact that medical assistance in dying is available only to people with disabilities and disabling medical conditions who are suffering. Having a disability or a disabling medical condition is one of the eligibility criteria in the law. And so it really is targeting disabled people. It is not available to people who are suffering, who are not disabled or don't have a disabling medical condition. Connie, should we go back to other questions?
I think I'm back up. Apologies. I seem to be functioning again. We've had sort of general comments in the Q&A, and I want to pick up on a couple of things that I've heard talked about by various of the presenters in the past. And Krista, I'm giving you a quick heads up that it's coming to you. I know that part of the conversation has been how the disability community's position has been perceived by governments, and this idea that in fact there's division in the disability community on this topic. I know that that's not the case, Krista, and I think it's really important to talk that through so people understand the coherence of the disability community's position in Canada on this topic.
Thank you, Connie. Yeah, that has been questioned and challenged quite a bit. And so I'll give you some examples. Over 200 disability organizations, national, provincial, and local, across Canada signed an open letter to the government against Bill C7, which is the new legislation that allows for terminating the lives of people with disabilities through medical assistance in dying if they are not terminally ill or not already dying. And we've had all kinds of grassroots kind of initiatives from people with disabilities on the ground. Would I say that there's not one single person with a disability in Canada who thinks that medical assistance in dying is a good idea? Of course, there are some people who may say that, but they're very, 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 that's a very, 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 very limited number of people, and often people who are not in the situations that most people with disabilities find themselves in, which is living in poverty without the right disability supports or any disability supports, not housed, improperly housed, or inadequately housed, all of those different pieces. But the disability community, this issue has galvanized the disability community in Canada more than anything else has ever done in the 26 years I've been working in this field. And there is real solidarity amongst persons with disabilities in their representative organizations, that this is bad legislation. And it's really our challenge is getting anyone to listen.
Thanks, Krista. I think that's a really important message to put aside the myth that there is, somehow an even and different perspective across the disability community. So thank you. I have a question which I'm going to expand on in the group, in the chat here. Neil is asking, how can the global disability community help to raise awareness and put pressure on the Canadian government? I think this is exactly the question that we should be asking ourselves collectively at the Conference of States Parties. I'm going to go back to Gerard. And Gerard, I think you were reflecting in your comments about your interaction with the Canadian government. I wonder if you could comment on sort of opportunities and next steps and strategies that not only the Canadians, but the cross-disability international community can use in raising awareness about this, and potential places where we could do that.
Yeah, thanks for that. And as you're probably aware, our interactions with the government became public after several months, and therefore available to advocates to push domestically in Canada. We'll have to regroup after this seminar to think through what possible next steps could be. I'm very concerned about the further potential expansion of the legislation, and that might provide us a wedge or a perch to become re-engaged. But you are right also that this is an issue that stretches broader than Canada. So there's got to be a way of working it up the agenda, so to speak, for the international community, so they become conscious of the risks and the dangers, and alert to some of the pitfalls that the Canadian experience has highlighted. So I'm going to have to regroup with my staff in Geneva and think that one through, but be assured we will think it through.
Sure, thank you. And thank you so much for your support on this issue. It's very much appreciated, I know, by my Canadian colleagues, and we'll continue to look to you for your leadership. I'm going to direct a question that we have to Gabrielle. The question is, can someone speak to why legislating some financial benefits for people with disabilities will not make MAID acceptable? Why is it still problematic? Excuse me for stuttering along here. Gabrielle, could you try to take a stab at that one?
So I am speaking on Gabrielle's behalf for accessibility reasons. I have a solid understanding of this argument, so I'll do my best here, but noting that I'm not Gabrielle, and she is much more eloquent than I am at most times. So the issue with stipulating, say, bring disabled people out of poverty and then we will allow MAID is really that we are arguing against involving the state in the death of disabled people at all. Poverty is not the only social dynamic impacting disabled people. There are many other inequalities that are embedded in our structures in Western society, Canada included. I'm sorry, I'm very anxious. This is not my usual circle here, but really it's an issue that we're not trading. We're not saying in exchange for raising us out of poverty, we are open to medical assistance in dying solely for disabled people. It's not a trade-off. We're not considering that. It is a recognition that this is a fundamental breach of our right to life and our right to thriving in community, as so many others have said more eloquently.
You were very eloquent, and I don't think anyone could have answered that question better. You did a perfect job. Thank you for that. We've just got a few minutes left, I think, on the Q&A. I think I'm amazed to say that we are just at the end of the session. I want to just end the session by directing a question to Catherine Frizzy. Catherine opened the session with such compassion, and I think that it would be helpful, Catherine, if you wouldn't mind, to end the session with some comments and maybe a warning to the world about what's coming. What's gone unsaid today? What are the things you think we need to circle back to and say to the global community who are just waking up perhaps to this issue?
Thank you so much, Connie. And not much has been left unsaid, and yet so much still remains to be said, because as everyone has acknowledged, this is an extraordinarily complex subject. It is complex in large measure because language itself is being manipulated in ways that really distort people's access to the truth. And so, you know, I want to flag a phrase that was in the Q&A from a post by Dr. Sonia Gaines, who is a very respected ally of this global, I hope, global protest, when he used the phrase privileged autonomy. And I think whenever we hear the word autonomy used as a justification, as a blanket explanation why we must have access to assisted death, let's pause. Let's insert the word privileged in front of autonomy and ask ourselves if that isn't perhaps what's really meant in the given context. Because for a person who is not encumbered in life from fully exercising the range of choices that they desire by virtue of their race, their indigeneity, their gender or gender preference, their poverty or their disability, only such a person can see autonomy, or can or will speak of autonomy as a justification for death. For the rest of us who don't have that kind of unencumbered, privileged autonomy, the meaning is very, very different. The implications can be called nothing other than eugenic. And so if there is perhaps a single word that we haven't spoken enough today, that may be the word eugenic, and the history that we know very well in our community. Thank you, Connie, and thank you to everyone who made this session possible.
Thank you so much, Catherine. I think that leaves us with the key messages that we need to take away. For the participants, you will be receiving a survey asking about the session, but also if you are looking for more information from any of the speakers or the organizers, you'll have some information there where to find more about this issue and how to be in touch if you want to take this forward and become part of the global awareness raising exercise that we're currently in. So I again thank all the speakers. It takes some bravery to tell the stories that I've been hearing today, and I really thank you for being willing to share your stories with the global community. And we urge the global community to open up and take these issues on in your own countries, and certainly we'll do our very best to make sure that people are listening in the cross-disability human rights work. Thank you again to all of our speakers, and thank you for being with us today.